Hi guys, my name is Gertrude. I'm a registered nurse, also known as world-class nurse. My goal is to create information to help nurses transition easily from school to the workplace. So today I want to quickly talk about some of the things you need to carry with you to have a successful clinical placement or to have an easy day when you show up for work. As a nurse, your work involves assessing patients, interacting with patients, taking down notes here and there. So you need to have with you things in your pocket. Like our pockets are usually filled up with so many things, so it's important that you have these things handy to just make your work easy. So I'm going to start with the first thing and the most important thing, which is pens. Whenever you're going to work, you need pens. Depends with what you need to take down. I usually like having different colored pens, especially a red pen to highlight what is important, what I need to do, and the other one is just a blue pen or a black pen to take down the notes. Another thing that I like to carry with me, not so much because I don't use it as often, is a stethoscope, but this really depends on the type of work you do. Especially if you work in surgery, I think a stethoscope is important because you need to assess return of bowel sounds, especially after your patient is back from surgery. So having a stethoscope is also very important whenever you're at work. Something also very important is the nurse's watch. This watch just goes to your pocket. Unfortunately, my scrubs don't have a front pocket, but usually you can just pin this, clip it to your front pocket. Some come with the clip, so you can clip it anywhere on your uniform, and this one I have is a magnet one, so I have to clip it in my uniform. So a nurse's watch is effective, especially when you want to count the respiration or you just want to look at the time. In England, where I work, there's a rule called bare below the elbows, meaning you're not supposed to have anything. So you can't have a wristwatch with you, you can't have any bangles like I am having now. Whenever I go to work, I take them down. So for that reason, you really need your nurse's Forbes watch, as it's called, just to help you, especially when you're counting your respirations. You need to count your respirations for 1 minute. So having this watch will help you do that. Another thing that I find really useful to have with me is a pair of scissors. You never know when you need a scissor just to, cut something, remove dressings, whatever it is. Having a scissor is very handy. Something else is a whiteboard marker. This also depends with your workplace. I usually like having this in my pocket to update the patient's board. Sometimes you get a patient, and on the patient's board you need to put in a few information about their diet, their mobility, their level of assistance, their name, and obviously date of admission. So I like having this type of watch with this type of whiteboard marker with me, just to note down information on the patient's board as they come along. Something else very important is a pen torch. This is a pen torch that you just, it's very bright, but it's ideal for assessing the pupil. This is especially important when you're doing a GCS score, especially if you're working in a place where patients are prone to falls. You need a pen light torch to do GCS whenever you need to do GCS. It's not necessarily for falls, but sometimes patients come with head injury and you need to check for hourly GCS or stroke unit. If you work in a stroke unit, very vital. But either way, you need this because you don't know when you need to do a GCS score. And finally, something that I never forget is my name tag. I really like having my name tag with me just to make it easier for people to communicate with me and to make it easier for people to know my name is Gertrude, and just helps my patient also. So name tag, something else that I don't miss with me at work. I know different nurses have different things. Having tape, you can have tape on your pocket just to make it easy whenever you come across something that you need to tape. You can have tape. You can carry a notebook just to note information that maybe you want to check up later. So whatever you need, just customize it. Please share with me what you usually have in your pockets. I know a nurse's pocket is full of so many things. Thank you for watching, guys. If you find this video useful, please share it with your friends, and please follow me on different social media platforms. I'm on Instagram, YouTube, LinkedIn, Twitter, and Facebook. Thank you for your time. Keep staying safe, keep washing your hands, social distance, and I wish you all the best. That is all from me today. Bye.